So you're going to say. Kia ora koutou. My name is Jen. I'm a heart health advocate here at the Heart Foundation. Tonight is our final event in the Heart Help Live series. We're discussing sleep, stress, and social connection for a healthier heart with general practitioners Dr. Taisia Cech and Dr. Marissa Kelaher. We're coming to you live from all over New Zealand tonight, with Dr. Taisia joining us from Wanaka, Dr. Marissa joining us from Nelson, and myself in Tamaki Makaurau. So it's important to note that this session is not intended as a substitute for professional medical advice, diagnosis, or treatment. If you have specific questions about your condition, contact your healthcare provider. So before we get started, a little housekeeping. If you have any questions during the presentation, feel free to add them to the comments section, and we'll cover as many as we can during our Q&A. Please do not include any personal details that others might see. So without further ado, I'll hand over to Taisia and Marissa.
Hi, thank you. I'm Taisia and
I'm Marissa.
and we're GPs and lifestyle medicine doctors, and we're feeling very privileged to be asked to speak today about our passion. Well, these three topics are something we're really passionate about. So I'm going to be starting us off with sleep, and then Marissa is going to be talking a bit about stress, and then I'll be talking a bit more about social connection. So hopefully give you a snapshot of why we think these topics are really important for heart health. So I'll start us off by talking about sleep. So we know that sleep deprivation is really key for cardiovascular disease, and we know that is not just getting not enough sleep, so less than sort of 6 hours of sleep, but also getting too much sleep can have a detrimental effect. And we know it can increase the risk. So we're talking about more than 10 hours. And we know there's an increased risk of things like high blood pressure, coronary artery disease, and overall heart disease risk. We also know there's a link to working long hours and short sleep duration, sort of independently, more so for men. And there has been an interesting study from it's called the Whitehall study, and it showed that working more than 55 hours a week was related to sleep disturbances, including shortened sleeping hours and difficulty falling asleep. So there's more involved than just the amount of sleep that you're getting as well. But regardless of the cause, not getting enough sleep it can have a big impact. And I think it's something maybe we don't consider enough, because we talk a lot about diet and exercise related to heart disease, and sleep is something that maybe is not discussed as much, and we know as GPs we probably don't emphasize it as enough as being really important. And there's a quote that Marissa really likes, and she says that the sleep is the golden chain that holds it all together, and I think that's very true. So I thought I'd just go over a little bit about how sleep affects the heart. So we know that when we go to sleep, we have sort of a balance throughout the day of the sympathetic, which is our fight-flight response, and then the parasympathetic, which is our rest and digest systems. And we know when you go to sleep, then there's a switch over, reduction of the sympathetic fight-flight, and then into the sort of rest and digest stage, what we call the parasympathetic. And this has quite physiological effects. So what it can do is decrease your heart rate, decrease your blood pressure, and then overall decrease how hard the heart is working. So basically gives a bit of a rest and restore for the heart. So you can see why not getting enough would be quite important. And so not just those effects on those specific things in the heart, but things like body-wide effects like increased cholesterol can happen when you don't get enough sleep. And we know that not getting enough sleep can also be related to mental health and addiction. So you might be more likely to emotional eat, drink alcohol, depression, anxiety, those kind of symptoms, which can have their own detrimental effect on cardiac health. We know that sleep deprivation is related to increased inflammation in the body, and we know that inflammation is one of the driving factors of a lot of heart conditions, like coronary artery disease. We know that your sugars go up if you're not getting enough sleep, which again is another independent risk factor, that your immune system is weakened. And also really interesting is the psychology and around eating. So there's been some studies to show that people who are sleep deprived have much poorer food choices. They tend to overeat, so they eat more calories, and also choose foods that are less healthy, like more saturated fat and sugar in their diet. There's also, we know, a really strong correlation with sleep disordered breathing, so obstructive sleep apnea, and it is quite prevalent in the population, so about 10% of adults, but we know that in conditions like congestive heart failure, then it can be up to 50 to 75% of these people also have obstructive sleep apnea, which is really high. And we know that that it's a risk factor for developing different cardiovascular diseases, and that if it's left untreated, it also affects things like high blood pressure, increases your risk of stroke, heart rhythm problems. So yeah, it's really important to get that checked out if you've got some concerns around that. And there's lots of sort of underlying factors about why that might be happening, and how it affects heart health. So things like it increases blood pressure and heart rate when you're having obstructive sleep apnea, and your oxygen levels go low, and so there's lots of physiological changes that are actually happening that can affect your sleep. Affect your heart. So we've got some top tips now for healthy sleep. And we might have heard of something called sleep hygiene, but we really rate it. We think it's super important to have a really good sleep routine and be aware of the factors that influence your sleep, because that empowers you to make changes in your day-to-day life. So we know the place of sleep is really important. So making your bedroom like your haven for sleep, having it just for sex and sleep only. So you're not taking your laptop into your room and doing work and stuff, because that relates your brain to sort of an area where it needs to be more active and thinking. And then that screen exposure is not good for our sleep. We know that keeping the bedroom at a good temperature is super important. We know that light has a big effect on our circadian rhythm, so it kind of sets us up for that 24-hour cycle. So getting bright light in the morning, getting outside is really good, but then that nighttime light, so being exposed to lots of blue light in the evenings, so dimming the lights, and then that screen time before bed, like trying to have an hour or two with no screen time before you go to sleep. Caffeine and alcohol have detrimental effects to sleep, and some people just metabolize caffeine a lot slower. So even if you're having, coffee at lunchtime, that can make a big impact to some people's sleep. Having a day nap can make a difference. So trying to keep, if you really need one, keeping them to a minute of sort of less than 20 minutes if you can, because it takes away that sleep pressure. So there's chemicals that build up in our system during the day that make us feel sleepy. And we know that adenosine is one of these, and caffeine blocks that. So you don't really want to, sorry, it's related to caffeine, but we also know that when you sleep, then you clear some of those chemicals out of your body, and then it makes it harder to sleep later on. And trying to have those day naps as early as possible as well. Diet, so certain foods can set you up for better sleep, and we know also sort of salty foods, sugary foods, processed foods at night time are not very good for getting good physiological sleep. Activity is really good, so getting some exercise, and preferably those really sort of fast physical cardio workouts earlier in the day, so it's not so stimulating at night time. And then a really big one is stress management, and we know that there's big effects with things like cortisol, which is one of our stress hormones, and related to melatonin, our sleep hormone. So stress is really large. So I'm going to hand you over, which is a perfect segue, to Marissa to talk a little bit about how stress affects our cardiac conditions, but also some top tips that we have for you too.
Thanks, Taisia. The other thing I'd often add is we forgot to kind of include this in our talk, is that sleep's so important that the American Heart Association is now including sleep as one of their kind of main cardiac risk factors. So it's becoming more and more well recognised that we really need good sleep for a healthy heart. So I'm going to cover stress next. And stress is an issue. Obviously, it's become a lot more prevalent over the last few years with COVID, lockdown, border closures. And we're seeing the effects of this both in people's mental health and physical health. But in terms of how stress affects our heart, so when we talk about stress, we talk about acute versus chronic stress. So acute stresses are those stresses that you have, say, like if you're, rushing to get out the door, you've got the pressure of writing an assignment or something. The acute stress is not so bad, but when this stress turns into chronic stress, which is a stress that doesn't go away, which is what a lot of us experience in our day-to-day life, that's when the health impacts start to occur. And I'll cover a little bit more about that in a minute. So when we talk about chronic stress, we know that it affects our health in a lot of different ways. It impacts on our immunity, so it makes us more prone to catching infections. It creates chronic inflammation, which, again, as Taisia mentioned, is becoming an increasingly recognised risk factor for heart problems. It affects our heart health, which I'll cover in more depth in a minute. It can put our blood sugars up through the effects of stress hormones such as cortisol. Impacts on our gut health, which, again, we're learning more about in relation to heart health, and it's a really exciting area of research that we both love. Stress affects our brain function, so things like, memory loss, even dementia are linked to chronic stress, and also impacts on things like fertility, mental health, and metabolic health. So things like, cholesterol, blood pressure, and heart rate are all linked into chronic stress. So we always like to kind of explain how things work as well as what to do about it, because I think if you understand what's happening in your body, it makes a lot more sense in terms of going, okay, this is what's happening, this is what I can do about it. So as Taisia mentioned before, we have a thing called our stress response, which is two different nervous systems that are kind of meant to be in balance. So one is the fight, flight, or freeze system, or the sympathetic nervous system, which you may have heard of. The other one is the rest, digest, breathe system, which is the parasympathetic nervous system. And ideally, we want these to be balanced. So we want to be able to respond to stress when we need to, but also be able to relax and kind of recover from it as well. When we talk about chronic stress, what happens is that stress response system is activated all the time, and we never get to go into the rest and digest system. And this can impact on things like our appetite, food cravings, weight, hormone balance, sleep and blood sugar as well. Which can lead to the symptoms of chronic stress, which can often be quite vague and mimic other health conditions, but things like fatigue, brain fog, muscle tension, chronic pain, poor immunity, and gut health issues are all kind of common symptoms that we see as general practitioners that are often linked into stress. And there's a quote, I think, from the World Health Organization that's they're calling stress the epidemic of our kind of century. And they estimate around about 80% of GP visits are linked to stress in some ways, which is pretty massive. And we definitely see this in our clinics as well. In regards to heart health, stress affects our heart health in a few different ways. And most of it is due to the impact of those hormones that I mentioned on our body. So when we're chronically stressed, it can put our blood pressure up, can put our heart rate up, it can increase the risk of things like heart arrhythmias. And it can also actually increase the risk of atherosclerosis, which is when we get plaque build up in our arteries, and that's what causes things like heart attacks and strokes. The reason for this is, as I mentioned, stress can increase inflammation, which is linked to atherosclerosis. It also affects endothelial function, which is the health of our blood vessel linings. And it causes a thing called oxidative stress, which damages our cells. So it's obviously complex, but the key thing is that stress has a big impact on our overall health and also our heart health. When we look at studies with stress in the heart, there was a big study called the InterHeart trial, and they found that psychosocial factors, including stress and depression, were directly responsible for about a third of heart attacks around the world, which is pretty massive. And this risk was independent of and only slightly less than the risk of a lifetime of smoking. So we talk a lot about smoking for heart health, but we need to be talking about stress as well. Interestingly, the effects of stress and depression on the heart were actually greater than the effects of high blood pressure and obesity. So it was a big risk factor. There's also been research looking at chronic stress, the effects of this early in life and also during adulthood. And we know that chronic stress, both early in life and during adulthood, is associated with a higher risk of future coronary artery disease, around about 40 to 60%, which is massive. So the message is clear, is that chronic stress plays a really big role in our heart health, and we need to recognise, be aware of it, and also prioritise stress management just as much as we prioritise not smoking and eating a healthy diet. There's also a relatively rare condition, but we do see it in general practice, that's directly linked to stress, and this is called stress-related or Takotsubo cardiomyopathy. This is a really interesting one. Basically, what happens with this is when we're under periods of intense emotional and physical stress, the levels of our stress hormones get so high that they actually stun our heart muscle, which can mimic a heart attack, and it even looks like a heart attack on ECGs. And I think this kind of just brings home how much of a role stress can have. So stress is not just psychological, it also has very real physical effects. We like to talk about tips for reducing stress in two different ways. So looking at practical ways to reduce the stresses in our life, and then also talking about a thing called stress resilience, which is changing how much stress can affect us, because there's always going to be some stress in life. So in terms of practical tips to reduce stress, prioritising sleep that we've just talked about, and eating a diet to try to keep your energy and blood sugar stable, helps, because we all know how much more irritable we are when we haven't had a good night's sleep or we're getting hangry. Being mindful of what you spend your time on. So we only have 24 hours in a day, and sometimes trying to fit too much in can be a big source of stress. So just being aware of where you're spending your time and whether it's on things that align with your values and what's important to you. Things like taking breaks during the day is really important, and we talk about this a lot in clinic. So I think often as a society we have a tendency to just work and then collapse at the end of the day. But taking those little breaks is really good for your nervous system and to reduce stress, and even things like blood pressure. Talk about having some quiet time in the morning. So we tend to have a spike of cortisol or stress hormone when we first wake up. It's called the cortisol awakening response. And so try not to add to that. So trying to start your day off a little bit slower, whether that involves just sitting and having a cup of tea, going outside, doing some meditation rather than rushing straight into checking emails and doing jobs. Easier said than done if you've got young children, but it can make a difference. Other things like getting outside for fresh air in your breaks, getting out into nature we know helps with stress. Having some screen-free and news-free time. So there's more and more research coming out that screens and things like social media are actually quite stressful for our brains, because there's so much stimulation and multitasking and attention switching that it actually puts our stress levels up. So it doesn't mean you have to not have screen time, but just being aware that actually having breaks is really good for reducing stress as well. Doing things like setting boundaries at home and work. Not always easy to do, but really does make a difference. And then practical things like trying to reduce your mental load where possible. And this is the mental load is what we talk about in terms of all the things that are going on in our brain, trying to remember stuff. So we say, like, booking appointments regularly in advance, bulk batching jobs, so doing a big load of washing all at once rather than lots of little ones during the week. Trying to do things like, having a grocery list of common foods that you can easily access rather than writing it all down each time. And these little things all add up to make a difference to our stress levels. And then also try not to do everything. So if you can, trying to delegate tasks to other people, and not being afraid to ask for help if you're feeling overwhelmed. There's a concept we really like that we use a lot, which is called the circle of control. And it refers to trying to focus on things that we have control over in our lives versus things that we can't control. So some examples of this is if, we can control how we react to situations, what we eat, how we spend our free time, what we read, whether we watch the news or not, whereas things that we can't control is what other people think of us, how other people react, the traffic, the weather, the news. And we know there's really good research to back up that if we try and focus our attention on things we can control, it makes a big difference to our stress levels, because we actually have the ability to impact on these things rather than worrying about stuff that we actually can't change. As I mentioned, the other part of stress management is changing a thing called stress resilience. So often we think that when we're exposed to an event, we get stressed, directly related to the event, whereas we know that things like our, interpretation of the event, belief systems that we have, they actually impact on whether or not we get stressed in response to things. So we have the power to change how we experience stress. And that's stress resilience is basically trying to do things in our lives that help us to cope with stress better and change how we respond to them. So some tips for building stress resilience and turning down our stress response. You might have heard of forest bathing or time in nature, and that can improve stress levels by up to 30%. Even a 10-minute walk out in nature has a huge impact on stress levels. And they've measured this in experiments, checking things like our stress hormones and looking at how it affects our brain. Lots of really good research to back up using mindfulness and meditation to reduce stress levels. And again, that changes our brain waves and our stress hormones. Things like breathing techniques, so like slow diaphragmatic belly breathing can really help, and it's a quick, easy thing that you can do during the day if you're busy. Exercise we know helps with stress, and a lot of people will use exercise as a stress response, and it's a great thing to do for heart health. Little things like, gratitude practicing, so focusing on things that you can be grateful for versus the things that aren't so great in your life helps with stress. We know social connection and volunteering has a big impact on stress and is actually really protective for our heart, as well as Taisia will cover in a minute. And then things like physical touch, so massages, hugs, and then spending time with people that we enjoy being around can really help. And then also trying to find a sense of purpose in life. So I guess it's a bit of a more abstract concept, but we know that, as humans, we need to feel like we have a purpose and meaning. And so trying to find things that are important to you and practicing them and making them a priority in your life rather than just going through life on autopilot can make a really big difference to our stress levels. Cool. I'll hand over to you next, Taisia, to cover social connection.
Thanks, Marissa. I always find it mind-blowing hearing all that, how stress is so interrelated.
Yeah.
And we feel like we charge through the day, and it's really sort of not something you see very easily, but it's kind of a self-reflection thing, and it has a massive impact. So it's good to hear all those facts. And
we try to remind ourselves of that on a regular basis.
We try to practice what we preach. So I'm like Marissa's just mentioned, social connection also plays a part in heart health, and I think it's probably one of those things that people, again, don't think a lot about in terms of their health and how important having strong social connections can be. And we know that having relationships that are positive can have a really powerful influence on our health. And poor social relationships have been found in quite good studies, so large meta-analysis, to be associated with up to 30% increased risk of heart disease and 32% risk of stroke. So big impact. And we know that having sort of strong social connections can do things like improve our life expectancy, again, plays a role in inflammation, reducing inflammation. It can even switch on anti-aging genes, protecting the heart, improving immunity, protecting against mental illness and risks of dementia. So all things that are related to heart disease as well, and play a role. And I think, again, like Marissa said, it's really important to understand why that might be influencing our health, and that kind of makes it seem more achievable, and it makes you be able to relate more to changes that you want to make. So the reason why we think it happens is that reducing stress levels, so building strong social connections reduces stress levels and also stress resilience. So those two factors that Marissa was talking about for stress, and as we've heard, stress plays a big role in heart health. And then having those positive interactions activates your parasympathetic nervous system. So something, again, that we've both spoken about tonight, that rest and digest system, it's really activating that pathway for us. Reduces our stress hormones, and then physical changes like blood pressure and heart rate. And we see this in clinic all the time when people come in and we take their blood pressure and we're like, no, just take a couple of deep breaths and try to relax. And we take it again, it's way, way lower. And people have just rushed in, or they're anxious about coming into the doctor. And we know there's a big impact there on stress and blood pressure, but we also have found that social connection is related as well. And then boosts our energy, it makes us feel better. So those feelings of happiness and self-worth are important as well. So we know that when we socially interact with people, there's hormones that are released, and hormones that are heart protective. So you may have heard of oxytocin, which is that love kind of hormone, that strong hormone that's released when a mother bonds with her baby. Serotonin, again, our happy hormone, and endorphins, and something called vasopressin, which helps sort of dilate vessels, and is another really important heart protective factor. And I guess on the flip side is when we're socially isolated, we're more likely to have poorer health for things like we're maybe more likely to smoke or drink alcohol. We're less likely to exercise and not look after ourselves as well, and maybe not manage so under stress. So we know those factors all contribute to heart health. So just a few top tips for improving your social connections. It's really not about the amount of friends you have. So not all your Facebook friends, if you've got a couple of hundred, doesn't mean that you're socially connected. It's those true friendships or interactions with people that make you feel really positive, and that are important to you, I think. So little tips like calling a friend instead of watching TV one night, just pick up the phone and sort of get out of your routine can really brighten your evening. Maybe planning sort of catch-ups regularly with friends so that you get out, maybe doing something at the same time, like going for a walk that can reduce your stress and get some exercise and have all those positive other benefits at the same time. Feeling like you're part of community, so joining activities in your community or joining a group, maybe getting involved in some volunteer work. Then we know that volunteering in itself can have really positive effects on the heart. Prioritizing time with your family. life is busy and there's lots to do, and I think there's work and there's all these other commitments that we feel we need to do, but really prioritizing that time is really important for you and your family. And then just simple things like don't forget to smile. So walking past somebody and they smile at you, even if you don't know them, can make a big difference to your day. So I think those little micro interactions with people can also have a good positive effect from a physiological perspective as well. So that's the end of our talk. Hopefully we haven't talked too fast tonight, because Marissa and I are both very passionate about these topics, as you can tell, and we often talk fast. But we'd love to hear any of your questions tonight. We're heading into a question and answer session now. So yeah, I'll hand you back to Jennifer. Thank you.
Awesome. Thanks, Taisia and Marissa. Really interesting stuff, and it certainly got me to reflect on some certain things that I could change. And I love that one about remembering to smile. It does make a difference in other people's day, but yourself as well. Yeah. So the first question we have is, Tracy asks, should you go to sleep at the same time, or is different okay?
So I think
this. Would you go?
Sorry. I'll start and you can segue in. So well, I think sleep, it is good to have a routine and a regular rhythm, and again, we're kind of creatures of all our cells have like a 24-hour cycle in the body, and so I think having a regular bedtime is quite important, and having one that's like early-ish is good as well, not too late in the evening. So I think, yeah, your body likes regularity, and we know that because some people are busy through the week and they sleep deprive themselves during the week, and then they try and catch up on the weekend, and whereas that has a small beneficial effect, I think there's still negative impacts of that sleep deprivation throughout the week. So it's much better to kind of have that regular set bedtime and sets your body clock. Did you want to add anything else to that, Marissa?
Yeah, so there's a lot of research coming out around a thing called circadian rhythm, and that's an area that I'm super intrigued with. So we know that, often people talk about the circadian clock, which is like, a body clock, but we actually know that every cell in our body has a circadian clock. And there's a lot of really cool research coming out showing that our cells in our body almost remember things each day. And so tying in with that, it's far, far better. And this is something that I try and work on, because obviously young children I'm working not super great at prioritizing sleep, but we do know, and there's more and more evidence coming out, that trying to go to sleep and wake up at the same time has a lot of benefits. So it's not just the hours that we sleep, but it's also having that regularity of time. And there's research coming out around things called circadian eating, which is eating at different times as well, which is a really exciting area of research. And we know that even our gut bacteria have got a circadian clock. So the little bacteria that live in our gut that have got a lot of health impacts, they even seem to remember what time it is. Humans are kind of creatures of habit, and I think it's probably an area we're going to see more and more research coming out about in the future. So it's a pretty exciting area to look into.
All right, so the next question we have, Margaret asks, why is the majority of research on stress done mainly with men only? Have you seen changes to focus on women?
That's a great question. I think that's not just stress. I think that's
everything.
Medicine in general, and there's a lot of strong women coming out now that are younger doctors that are trying to change that and saying, hey, this doesn't make sense, like this is really skewed and biased, and we like even the way women are treated in hospital and how decisions are made, I think is related to a lot of research that's based on men. So I think this is changing, but it is still very strongly prevalent.
Okay, so Kendra is asking, how do I maintain low stress levels while waiting for a heart surgery that seemingly never comes? The waiting is the worst stress, putting my life on hold with no end date.
That's hard. I can answer that if you like. So I think the first thing is to acknowledge that this is a really hard thing, and it does have a big impact on people's lives. And we know that waiting for something that is really impacting your life is super hard. And I think, we don't want to kind of underplay the significance of this. But I guess what we were talking about before is kind of going, there's things in our lives that we can control versus things that we can't. And, as much as we would like to impact on when surgery can happen, in reality, often we don't have much control over it. And so I guess our take would be like, be kind to yourself and acknowledge it is hard waiting for things like this. but sometimes trying to change the focus back to things that you do have control over in the meantime. So things like, trying to eat as well as you can, trying to get exercise within the limits of what you're able to do with your heart. Looking at stress management, sleep, social connection, because these things can all help to reduce the stress of waiting, and also help to optimize your health so that you'll get the best results in recovery from your surgery as well. And also how we're talking about practical ways to reduce stress. So if your heart condition is kind of affecting your ability to do like day-to-day things, and then not being able to do those things is creating stress, then maybe reaching out to family or friends and going, look, if you're struggling to mow the lawn or do heavy cleaning, can someone come and help that? Because if you're not stressing about not being able to do stuff, then that can help with it as well. And then I guess also, we know that waiting for, if you've got a significant health condition and waiting to kind of get that fixed, can have a really big impact on people's mental health as well. And then we also know that, mental health has an impact on heart health. So if you are really struggling, and you're noticing that it's impacting on your mental health, then I guess not being afraid to reach out to getting input from, say, like a psychologist or a counsellor. And it won't obviously change your situation in terms of your heart, but it can help to just reframe your thoughts. And there's a lot of leeway around. We know that humans have got a thing called neuroplasticity, so we do have the ability to change our thought patterns and our perceptions of things, and that links back into that topic of stress resilience that I was talking about. Is just doing the things that you can and you do have control over, to try and reduce the stress as much as possible while waiting for the surgery, which will hopefully happen at some stage.
So Annette asks, how do you get a good sleep? Even 4 hours a night would be good. I've tried sleeping pills for a few nights. I have a busy mind.
That's something we see in clinic all the time. I guess it's a massive question, and we could do another couple of hours on that. I think the sleep hygiene stuff is super important that I went over briefly. You can even Google sleep hygiene if you want to look at those factors a little bit more and understand them. Definitely reaching out to your practitioners, and sometimes pills help people, but sometimes they don't. There's other things like sleep restriction therapy. I guess it's sort of addressing maybe some of the psychological reasons why you have a busy mind. So is it anxiety or something that needs addressing? There's cognitive behavioral therapy that's another tool that you can tap into. So there's sort of different approaches, and I guess pills can be good, but we do know that you can end up quite reliant on pills, and also they don't give you the physiological sleep, sort of restorative sleep for some people. So I think looking at some other options, and maybe even asking next time you go in for your pills, your GP, are there other options for me to try? Or is there a health improvement practitioner in the practice that I could talk to, or could I be referred for some cognitive behavioral therapy? Just asking and reaching out, I think, for alternatives, and feeling like you're not stuck and you've got some other options.
I'd add to that as well. We also often talk to people. I think we have this expectation that we can go all day and then fall asleep the moment our head hits the pillow, whereas we know in reality that doesn't work. So we talk a lot about the different hormones. So there's cortisol, our stress hormone, and melatonin, the hormone that we need for sleep. And they kind of work in direct opposition to each other. So there's a cool graph I often show people in clinic where, as cortisol goes up, melatonin goes down, and then vice versa. And so if you're kind of running on cortisol all day, you won't get to sleep well, because your melatonin, which is the sleep hormone, doesn't have the chance to kind of go up and make you sleepy. And that's where things like, trying to have a bedtime routine. And I do this a lot with patients as well, as going, as hard as it is when you're busy, trying to set aside like an hour or so before you go to bed where you actually kind of signal to your brain and body that it's time to go to sleep. So that's things like, switching off your work, switching off your screens, trying to find some things that you can do that help you to relax and switch off your brain as well. So that's whether that's like a warm bath, or, meditation, or some yoga, or reading a book, or listening to music. And just trying to prioritize getting those signals to your brain that it is actually time to sleep, to get your natural melatonin levels coming up, and that can make a big difference as well. We've also got we've got a couple of blog posts on our website, which is Your Lifestyle Medics, on kind of lots of practical tips for improving sleep as well. So check those out if you wanted to do more. And we work a lot with people around trying to improve sleep, because we know just how important it is. And there are definitely lots of things that can help, but sometimes it takes a bit of problem solving and getting to the root of what's actually affecting your sleep.
So Helen asks, where would be a first stop to get support in building stress resilience? I'm doing what I can, but I feel like I need some support and guidance.
As Taisia mentioned, a lot of GPs now have people called health improvement practitioners, which are often free to see. And these people are kind of trained in, various therapies, and they're great to talk to, just because they often take a really practical approach and kind of go through, like what are some things that are causing stress, how could you reduce your stress? And we know that when people are stressed, we tend to kind of get a bit of a snowball effect, whereas our brains run away with us and we'll start worrying about not just one thing but everything in our lives. And so sometimes breaking it down and kind of going, where are your main stresses coming from, and what are some simple things that can help? So health improvement practitioners are great. If you're really struggling, you can also often get a referral through your GP to see a mental health provider, so whether that's a counsellor or psychologist. And that'd kind of be my top tips for it. And there's a lot of great resources online as well, to kind of with practical tips. And I think the Heart Foundation's probably got some on their website in terms of like tips for reducing stress as well.
Cara would like to know which foods are conducive for sleep.
There's a good blog post on our website about that.
Not to promote our website, we've got a whole blog post on it. Yeah.
I'll let you start because you wrote it, Marissa, and I'll chime in.
Oh, I've got to try to remember now. I wrote that one a while ago. Yeah. So in particular, foods that help with sleep, I guess we talk about trying to, most of us trying to avoid foods that we know negatively impact sleep. So there's some research to suggest that trying not to eat within 3 to 4 hours of bedtime helps to improve sleep quality, and it also reduces the risk of things like reflux, which can impact on sleep. As Taisia mentioned, trying to avoid really salty foods before bed. This affects us in 2 ways. It makes us thirsty, which means you're more likely to get woken up to need to pee overnight. But it also impacts on like blood vessel dilation, which links into sleep quality, which is a bit more complex. But trying to avoid really salty or salty foods before dinner. Sugary foods, again, often a good idea to avoid in the evening because they can kind of act as a stimulant and wake us up. And then obviously avoiding things like caffeine, alcohol, good idea to avoid a few hours before bed because that can also have a really negative impact on sleep quality. There is a little bit of research around things like trying to have complex carbohydrates in your evening meal to help with sleep. And there are certain foods that contain compounds such as like tryptophan or melatonin, which can help sleep as well. And off the top of my head, I'm trying to remember, I think there's things like kiwi fruit, dairy can be helpful, bananas, I'm trying to think back now.
Cherries, you get that, those
cherries
type
also,
cherry juice you can get from the chemist.
Yeah. I mean, the evidence for foods that help sleep is not as great as the evidence for foods to avoid around bedtime. So, but I kind of say that, these are all healthy foods that you can include in your diet as well. And it's kiwi fruit season now, so maybe trying to try a kiwi fruit in the evening can be helpful.
So Janice asks, what are your thoughts on melatonin to help with sleep?
I'd say obviously, talk to your doctor. Like we can't give personal advice, and melatonin's not for everyone. We do use it quite a bit in clinic. Like it is a lot safer than sleeping tablets, for example. And for some people, it can really help with sleep. But again, I think that's probably a good. I mean, one melatonin is prescription only in New Zealand anyway, so you'd need to see your doctor for it. But that would be a good one to maybe have a chat to your health practitioner and kind of ask about the pros and cons for your situation. It definitely can help some people with sleep though, for sure. Like we often prescribe it in our clinic for people that are wanting a little bit of extra help with sleep.
I think it can also be one of those things that maybe you don't use in the long term, but you use in the short term while you're working on some of those other sleep hygiene things and other sort of tools in your toolbox for sleep to help you.
Okay, so Shan has AF, so atrial fibrillation, and juggles a busy job. She's asking for tips on how to take short breaks during her work day without annoying her boss.
I'd say advocate for yourself and prioritize your health, because you're going to be more productive and much better at your job if you're having those breaks. And we know that the brain is not supposed to be switched on and charging all the time, and having a break is probably going to benefit your boss. So if you could sort of angle it in that way towards your boss, hopefully you'd get more buy-in. But I mean, I think in general, work should be providing you with breaks, and you are entitled to some as well. So make sure that you don't feel like you have to go all day. But little things can make a difference, like not eating your lunch in front of your desk, and like we try and take our own advice as well. Getting outside, getting a little bit of sunlight if you can, having your lunch outside in the park or something, or going for a little wander at lunchtime can make a difference. Adding in that kind of incidental good habits, like walking to, and parking a bit further from work and walking, and those little things can all make a difference to your general well-being and stress levels and sleep, and has that flow-on effect. So I think it's prioritizing it, and then even things like going to the toilet and doing some deep breathing or something like that. No one knows what you're doing in there, so if you take 5 minutes to yourself and do a little bit of relaxation stuff, I think you're very warranted to do that. And taking your headphones and downloading some, you can do some little mindfulness or meditation things on your phone. You can do walking meditations at lunchtime. Just download an app. There's lots of free ones out there. So I think just adding in those little things slowly, building in habits, it becomes something you do often.
I'd say
it's about consistency. Hey?
Yeah. And I think with work as well, I'd say the other thing is avoiding the temptation to start checking your phone in your breaks, because we all do it. But we know that if you've got a demanding job, if you're adding in things like scrolling social media in your breaks, your brain doesn't actually get a break, and so you kind of stay in that stress mode. And as I mentioned in the talk, there's a lot of research coming out showing that social media and screens are actually really, really tiring for our brains, because they're so stimulating, and we're doing a lot of multitasking as well. So when you are having those breaks, especially if you don't get many of them, try and maximize the benefits that you get. So like Taisia said, going and doing some deep breathing in the bathroom, stepping outside for a few minutes, even if it's just 5-minute breaks, if you really use them in a way that helps to bring your stress levels down, they can be incredibly effective. And we talk about things called micro moments, which is, when you've got a really busy job and you don't get long breaks, just even having those, 30-second breaks. And like Taisia said, sometimes a tip I often say to people is, trying to link the habit of going and washing your hands with doing some deep breathing in the bathroom, or, shutting the door to your office if you can and lying on the floor and doing a 5-minute meditation and hope no one walks in. So those little things can make a big difference. And if we know, there's really good research showing that workers who are happy and less stressed are more productive at work. So they tend to be much more efficient with the work that they do. They also take less time off work for illness. And if you're linking that into your health and going, we know that stress is a major trigger for AF, maybe talking to your boss and saying, look, if I take some breaks, I'm more likely to be healthy and less likely to take time off. So I'm going to be a better worker, and see if you can angle it that way, because then, they'll be seeing the benefit of it as well.
Oh, awesome. So Helen asks, is sleep apnea more common in people with heart conditions?
Yes, I think I went over that in the talk. So yeah, definitely more common, and especially for things like congestive heart failure. And it is a little bit chicken and egg kind of thing, because you're more likely to have it sort of breathing problems and stuff if you've got heart conditions, but we do know it is significantly more prevalent in people with heart conditions. So yes, the answer is yes.
Yeah.
And I guess probably the thing is, if you think you might have a breathing problem at nighttime, or you're not waking up feeling refreshed in the morning, or your partner's noticed that you stop breathing in the nighttime, or gasping, or loud snoring, or any of those kind of little things that don't sound quite right, just have a talk to your health professional about it, because there's so much undiagnosed out there that I think people are probably not seeking help early enough and getting support for it, because there are things that can be done to support you.
So Jimmy wants ideas on how we can talk with his family about his heart condition. They don't understand how much it affects his daily life.
Do you want to talk about Jimmy?
Yeah, I mean, that's a tricky one. I guess, we're a big fan of being honest and open with people. And, sometimes I think when we've got health issues, we have the tendency to try and, put a brave face on and, try and show the world that we're fine and we're coping. Whereas, honesty is a great policy. And if you are really being impacted by your heart health, then, not being afraid to talk to people about it, and actually just saying, look, maybe, sometimes setting aside a time for it and actually talking rather than, trying to fit it into other things, and just being open and saying, look, this is how it's affecting me. This is the impact that it's having. And I think sometimes it can be scary to do that, but more often than not, you'll be surprised at how open people are when you actually do try and talk to them honestly, and that they'll, people are often much more open to kind of hearing what you say and much more receptive than we fear. So I would say honesty is the best policy, and open communication is, vital for healthy relationships.
I think maybe also explaining why, because some people, they'll see the end effect of it. So say you're more tired or you're more grumpy, or, it's affecting you in some way, but they don't realize why it's happening to you. So maybe you're not getting a good night's sleep because you're feeling breathless at nighttime, and that's because you've got, congestive heart failure, or sometimes kind of relating it back to what's going on with your body, and then why it's making you feel like that might make them understand a little bit more about how you're feeling or how it's impacting you.
And often being specific with exactly how it's impacting you too, because I think, again, we tend to be quite vague and often go, oh, this is affecting my health. Whereas if you say maybe, like it's making me breathless, I can't go out for walks like I want to, I'm not getting a good night's sleep, I'm scared of having a heart attack, and actually, being really specific with how it's affecting you, because I think as humans we tend to, things make a lot more sense if we know the specifics of stuff rather than kind of vague concepts. And then that also has a lot more impact as well. Like if people can actually really hear exactly how it's impacting you, that can often help to give them a lot more context and kind of understand just how much it is kind of having an effect on your life.
And maybe give them also some tools to your family to help you as well. So they understand why, and then they can kind of fit in, maybe I can, help you in this
with
way
the
or
lawn
that way.
mowing, or
depending on what's affecting you most. Yeah.
So Cara asks, is it good or bad reading a physical book, not a tablet before bed? I guess that means rather than a tablet before bed. Or is it better to listen to relaxing music?
Well, I think everybody's different.
Very much your choice.
Yeah, I guess it's the tablet side of things, like Kindles don't have the backlight, so the light stimulate the sort of light we know suppresses melatonin, so that's why things like Kindles with no backlight or an actual book is better than screen time. But again, if you're reading a really interesting book that might keep you awake, or that you just want to read a couple more chapters, then maybe that impacts your sleep, so you have to listen to what your body's saying, I guess.
Yeah, we always talk to people about, rather than saying you feel like you should do this and this, maybe, just think of things that actually help you to feel relaxed and focus on doing those, rather than feeling like you should follow like a set guideline of you must do this before bed, because everyone's different and some people love reading, other people don't. And just being mindful and tuning into what helps you feel relaxed before bed, and then trying to do that on a regular basis.
So Kieran wants to know, is there any specific sleep positions that are better for people with heart issues?
This is a really interesting question. I don't think there's good evidence for anything specific that I know of, and maybe Marissa can chime in with that, but I think there's a few angles that I want to discuss. Like, we know certain conditions like congestive heart failure, lying flat can make people feel more breathless, and so they feel better propped up on some pillows. There has been a little bit of evidence that people with congestive heart failure again tend to avoid lying on their left side, and that just might be because they're not feeling as well when they're lying on that side. But I don't think I haven't read any science to say that you shouldn't sleep on your left side if you feel comfortable in that position. So I think probably listening to your body is the best indicator. But in terms of science, not that I know of. Marissa, do you have any comments on that?
No, so usually you'll know which position you sleep best in. And I think, tuning into kind of which one you feel most comfortable in, especially if you've got breathing issues, and what gives you the best night's sleep, you're going to get far more benefit from that than worrying about whether a certain sleep position is going to affect your heart health. Because like Taisia said, there's really not a lot of science to back that up.
So next question from Frank. He asks, what are some signs that my stress levels might be negatively affecting my heart?
I guess I'd say tying it back into what I was talking about with the stress section. So, obvious things like in our job, often when we see people that are under significant stress, things like chest pain, high blood pressure, palpitations, racing heart, these can all definitely be signs that your stress levels are quite high and the stress hormones are impacting on your heart health. And then I guess there's more subtle things as well. So like, if your stress is affecting your ability to sleep, if it's giving you high blood sugars, like if you're diabetic, these are not necessarily directly going to be affecting your heart, but they're all risk factors for heart disease. And then I guess thinking a bit more laterally as well, going, if stress is making you smoke or drink heavily, or like, be less likely to exercise or, eat well, then obviously that's going to have an impact on your heart health too. So it can kind of come from a lot of different angles. But in terms of physical symptoms, probably what you're looking for is things like, chest pain, high blood pressure, racing heart, kind of the common ones that we talk to people about.
Oh, okay. Just waiting for the next question to pop up. Won't be long. Okay, so the final question tonight is from Carolyn, who asks, can you talk me through a really short relaxation exercise I can easily fit into my day?
Oh, that's a good question. Yes, we could. We've got actually a little video on our website done by our yoga teacher, some stress breathing for stress. I think it's 5 minutes long. It's free and it's on there. But I know I talk to a lot of patients, and Marissa, maybe you've got another technique, but I talk to a lot of patients about basically just a breathing technique of breathing in for 4, holding for 5, and breathing out for 6. And I do in my own life a lot for stress, and I feel that makes a massive difference. So I think really tuning into finding a few little tools like breathing can make a big difference in your day. But if you there's lots of techniques like making sure you're breathing from your belly and that you're relaxing your shoulders and those kind of things, and breathing through your nose. So there's little tips, I guess, but that would be my big one is find like a little 1 minute or a 30-second breathing technique, and we teach it. We teach it to kids now more in kindies, and I've been teaching it to my kids too about learning some little breath techniques, little mindfulness things that they can do, like smelling flowers and blowing out the candle. And they, even at that age, they can get that. So I think just having those little tools in your toolbox is helpful. Would you add anything there, Marissa, that you talk to your patients about?
I'd say if you're busy, often people that have got quite busy jobs and busy minds will often really struggle to do things like meditation to start with. And I mean, meditation is one of those things that you really have to practice to get it working well. So definitely has benefits, but maybe not quite as easy to start with. Whereas breathing exercises, like, anyone can do them. So even if you're really stressed, you can do a breathing exercise, and you can do them, like Taisia said, in the bathroom while you're sitting in traffic, when your kids are bugging you. So and we've got a video on, like I said, on our website under the free stuff section on Your Lifestyle Medics, which is a great kind of evidence-based breathing technique. And the other one I often talk to people about is what's one called box breathing, which again is kind of it's usually about 4 seconds, but if you are struggling with shortness of breath, you can shorten it to even 2 or 3 seconds for each cycle. And again, that's trying to breathe in through your tummy rather than your chest, and taking a big breath in for 4 seconds, holding for 4, breathing out for 4, and then holding for 4. And even a few cycles of that, like there's really good research showing that those type of breathing techniques can drop stress levels like dramatically, even with a minute or 2. So they're often the first things that I'd suggest, like trying to add into your day-to-day life. And then, once you're working on that, then you can potentially start to add in like some short meditations and stuff as well, which I'm a huge fan of, but I recognize that, a lot of people struggle to meditate if you're highly stressed. So the breathing's probably the good place to start.
And I think we underestimate how powerful that can be. Like I've tried it myself, and I've seen it in my patients, and just that tiny, exercise, doing that for a couple of minutes can make a massive difference. And we recently interviewed somebody who was a breathing specialist, and the physiology of what's actually happening in your body behind the breath is just amazing. So don't underestimate those tiny little snippets in your day, I think.
Yeah, so we've got a podcast episode we just released. It's all about breathing on the website, which we love that stuff. And I think to demonstrate to patients, what I often do is when they're coming in for a blood pressure check, is I do a blood pressure and then get them to breathe for a minute or 2 and then recheck it. And blood pressure drops like dramatically. Like it's really amazing how much it will drop down, and same with your heart rate. And I think that's a great way to just demonstrate that the breathing actually has physical effects. It's not just making you feel better too. And then often that can be a great way to get people to start to kind of, incorporate breathing into their life, especially if they're having things like, high blood pressure or a racing heart as well, because it really is very powerful.
So we've covered all the questions we have time for tonight. Taisia and Marissa, is there anything else you'd like to add before we wrap up?
No, I think
Thanks for having us.
been some great questions as
Yeah.
well, and I think just don't underestimate. I mean, we just said that about breathing, but also just those things like obviously diet is important, and exercise is important. Those lifestyle factors can have a huge impact on your health, but also the ones that we talked about tonight, which are maybe sort of more on the peripheries of people's thoughts. But yeah, sleep, social connection, and stress have big impacts on your health, and they're tools that they're free and tools that you can kind of utilize yourself. So yeah, I think you have them in your mind and prioritize those kind of things in your life.
We talk about what's called the 6 pillars of lifestyle medicine, which are kind of all the areas of health that are proven to impact on our health. And those are nutrition, sleep, stress management, social connection, movement, and avoiding harmful substances. And I think we often tend to focus on nutrition and exercise and potentially smoking and forget about the other stuff, whereas we know that they're actually just all as important as each other. So I often talk to my patients about, prioritizing social connection and having a good night's sleep just as much as you would eating a healthy diet. And, obviously some things are harder than others to juggle in a busy life, and you don't have to do everything perfectly, but trying to be, I think, mindful of the fact that there are these things that impact on our heart health, and trying to prioritize them just as much as you would, the standard stuff, because they all have just as much of an impact on our heart health as well as our overall health as well, and can make a big difference to, how you feel, your quality of life, and your overall health too. So they're super important.
Oh, thank you so much for everyone who's participated tonight. And Taisia and Marissa, we can't thank you enough for joining us tonight as well and sharing your expertise. Your insights have been absolutely invaluable.
Thank you.
Thank you.
Thank you to everyone for joining us and asking some great questions. This is the last session in our Heart Help Live series. We'd really love for your feedback. So please use the short survey that will be posted in the description. We hope you found this series useful. Thank you, and Pomare.
See you.
Thank you.
Thank you.
Thank you.